Proceed.
Hi, my name is Myra. I'm going to be your nurse today. Can you please tell me your name and date of birth?
I'm OGonzalez and was born January 20th, 1998.
Okay, so I'm here today to do a complete head-to-toe assessment. Are you comfortable with that?
Yes.
Do you feel safe?
Yes.
And are you comfortable in the position that you're in right now?
Yes.
Okay, so first I'm going to wash my hands. I'm going to provide privacy for the patient, and I'm going to don on gloves. Okay, so first we're going to begin with your head. So looking at the head, it's normocephalic. Now I'm going to begin palpating it. Okay, so no nodules, no lesions noted, no infestation. Hair is even throughout. Hair is thick of texture. Any tenderness when I'm touching your head?
No.
Okay, so there's no tenderness noted. Okay, now I'm going to proceed to your eyes. Eyebrows are symmetrical. There's no swelling, no redness, and no lesions noted to the outside of the eyes. Eyelashes are even throughout, upper and lower, and eyebrows are even throughout, bilaterally, and symmetrical. Sclera is white. No foreign bodies noted, no redness. Okay, Mr. Gonzalez, can you please pull down your eyes? Okay, inspecting the conjunctiva, it's pink, no foreign bodies noted, no redness, and no discharge noted. Can you open your eyes wide for me? Can you close them shut for me? Okay. Any discomfort with that?
No.
Okay. So now I'm going to check your visual acuity. If you can cover one eye with your hands and look straight ahead and read line 4 for me.
A, B, C, D.
Can you read line 5 for me?
E, F, G, H.
Okay. Can you do the same thing with the other eye, please?
A, B, C, D. E, F, G, H.
Okay. So visual acuity, meaning that he can see at 20 feet while others can see at 20 feet also. Now I'm going to be checking for the confrontation test, which is checking peripheral vision. So I'm going to stand in front of you, and I'm going to put both fingers to your side. You're going to tell me which finger is moving, okay? Look straight ahead, please. Look straight ahead, and you're going to tell me which finger is moving.
Left. Left. Right.
So peripheral vision is intact. Now I'm going to be checking. So if you can just look straight ahead. So pupils dilated at 3 plus bilaterally and constricted at 1 plus bilaterally. So pupils are round and even bilaterally and able to accommodate and react to light and distance. Now I'm going to check your extraocular movements. So if you can just follow my pen with your eyes without moving your head or neck, okay? So patient is able to um, follow my pen light, which is the 6 cardinal gazes of sight, and no extraocular movements noted. So that is cranial nerve 4, which is the trochlear and cranial nerve 2, which is the optic nerve, are all intact. No astigmatism noted and no extraocular movements noted. So I had you raise your eyebrows already. I had you smile. Can you smile for me? Can you frown for me? Can you puff out your cheeks? So if you can close your eyes for me. I'm gonna touch on your face and you're gonna tell me where I'm touching, okay?
Forehead. Left eye. Left cheek. Chin. Right eyebrow. Right cheek. Chin.
So, you can open your eyes back up. So, facial nerve 7 is intact. Facial nerve 5, which is the trigeminal nerve, is intact. There's no drooping, no lesions noted to the face, and no swelling. Moving down to your ears now. I'm gonna pull on his penna and press on the tragus, and tell me if you feel any tenderness, okay?
No tenderness. No tenderness.
Looking at bilateral both ears, there's no redness, no swelling, no lesions noted, no extracellular. Okay.
No tenderness. No tenderness.
Okay, pulling on the pinna and pressing on the tragus, no tenderness noted. I would like for you to close cover one of your ears with your hand. I'm gonna whisper a word, and I want you to tell me what word I'm saying. Okay?
Understood. Girl.
Now we're gonna do the same thing on the other side.
Girl.
Okay. So right now, noted, no tenderness noted, and he was able to hear what I said bilaterally. So cranial nerve 8, which is the acoustic nerve, is intact. Now we're gonna move to the nose. Nose is symmetrical. Nose is midline. Sorry, midline. No discharge noted. No deviations. Um, no lesions. No nodules. Can you look up for me? Okay, so I will have a pen light. I'm looking in. No deviations noted. No discharge and no buildup in the nose. Okay, so now I'm gonna check the olfactory nerve. If you can close out one side and breathe in, and do the same thing on the other side, please. Okay, nasal passages are patent. Patient is able to breathe in and out on both sides with no occlusions. So, if you can close out one side of your nostril and just tell me what you smell.
Cinnamon.
The other side, please. Okay. So cranial nerve 1, which is the olfactory nerve, is intact. And now I'm going to palpate your sinuses. If you can tell me if there's any tenderness, okay? So I'm palpating the occipital,
No. No
frontal,
tenderness.
and maxillary.
No tenderness.
Okay, so no tenderness upon palpating both sinuses. So now we're going to move down to the mouth and neck. Lips are symmetrical, pink and moist, no lesions, no discharge, no swelling noted. I'm going to pull down on your jaw. Don't let me open it, okay? And if you can just push against my hand, okay? And shrug your shoulders for me once again. Okay, So cranial nerve 11, which is the spinal accessory, is intact, and jaw strength is 505. So can you open your mouth for me, please? Can you stick your tongue out? Tongue is midline, no lesions, no redness, no swelling, no bleeding noted. Can you move your tongue up for me? Out your mouth and up, to the side, to the left, to the right, and all the way out, please. Okay. Can you say ah?
Ah.
Okay. Open your mouth. I would like to look inside your mouth. Okay. Oral mucosa is pink and moist. No redness. No swelling noted. 32 teeth. No caries noted. And uvula is of normal size, pink and moist with no white patches. Tonsils were 2+ bilaterally, pink and moist, no redness and no white patches noted. Tongue is pink and moist, and tongue is rough. Cranial nerve 9, which is the hypoglossal, is intact. Cranial nerve 10, which is the vagus nerve, is intact, and cranial nerve 12, which is the hypoglossal nerve, is intact. Cranial nerve 9 is the glossopharyngeal. Can you please swallow for me? Okay. Cranial nerve 9 is intact, which is the hypoglossal. Patient is able to swallow with no difficulty. Now, so now I'm going to displace your trachea so that I can be able to palpate your thyroid glands. Let me know if there's any tenderness, okay?
No tenderness.
Anywhere on your neck.
No tenderness.
So, thyroid glands are palpable. No nodules, no tenderness noted, no swelling. And now I'm going to move on to your lymph nodes. So we have, if you can turn to the side for me. So we have the pre-auricle, we have the post-auricle, we have the occipital, we have the tonsillar, we have the tonsillar, we have the mandible, and if you can turn for me, right there, and we have the submental. So palpating each area. And then we also have the anterior cervical, and the posterior cervical. Any tenderness? Okay. And then we also have the supraclavicular. Okay. Any tenderness? Okay. So palpating the lymph nodes, no nodules. Now we're going to move down to the cardiopulmonary. So looking at the patient's anterior and posterior, you can sit up for me, please. Anterior and posterior is less than transverse. No accessory muscles are being used. Breathing is even and unlabored. Chest is rising and falling evenly. Skin is normal skin tone throughout for his ethnicity. No pallor and no cyanosis noted. So the first thing I'm going to do now is I'm going to monitor his respiratory rate. Normally you would monitor it for a full minute. I'm going to do it for 15 seconds and multiply it by 4. And normally you do not tell the patient when you're checking their breathing because then the breathing pattern is off. So the patient is breathing at 16 breaths per minute and breathing is regular and unlabored. So I'm going to I'm gonna check for we're gonna start from the back. So if you can turn around for me, turn. So first we're gonna check the thoracic foot posterior thoracic chest expansion. So if you can take a deep breath in and out again, please. Okay, chest rises and falls symmetrically. Thoracic expansion is good. And now I'm going to, every time I touch your back with my hand, if you can say 99. Go out. I'm going to now listen with my stethoscope. So every time I touch your back with the stethoscope, every time I move it, you're just going to take a full deep breath in and out, okay?
Understood.
So breath sounds are even throughout. And this is breath sounds. I'm going to check, inspect the spine. Just any tenderness.
No.
So no kyphosis, no lordosis, and no scoliosis noted. No tenderness to the spinal alignment. So if you can turn around for me now. Now we're going to do the same thing that we did in the back. We're going to do it in the front, okay? So take a deep breath in for me. Again. Anterior chest, thoracic chest expansion is even. Chest rises and falls with no difficulty. Now every time I move my hand again, you're going to say 99. So tactile premises is um, there's no difficulties. So now I'm going to listen to your breath sounds with my stethoscope, okay? Okay, you can lift your hands up to the side, please. The other side. So breath sounds anteriorly and lateral are even. And now we're going to move down to First, I'm going to start by feeling for the carotid arteries. Carotid arteries are toothed bilaterally. I'm going to listen to them with my stethoscope. If you can take a deep breath out, deep breath in and out the mouth. Deep breath in and hold it. Let it out. Deep breath in. Hold it. And out. Okay. No bruise noted. And now we're going to go down to, I'm checking for any heaves and thrills. No heaves or thrills noted. And now I'm going to get my stethoscope. So to the right, sternal border, second intercostal space, we have the aortic valve. To the left sternal border, second intercostal space, we have the pulmonic valve. Left sternal border, left third intercostal space, we have Erb's point, which is the point where S1 and S2 are heard equally. That's the love dub. Fourth intercostal space, left sternal border, we have tricuspid valve. Left sternal border, fifth mid-clavicular line, we have the mitral valve. And that's the point of maximal impulse, the apex of our heart. Okay. So heart rate and rhythm is even throughout. No murmurs noted. So for the purpose of the video, patient is supposed to be laying down. We're moving down now to the GI system, gastrointestinal and genital urinary system. For the purpose of the video, again, the patient is supposed to be lying down. At this point, he's sitting down. So when you start, the first thing you do is ask the patient, when was the last time you had a bowel movement?
Yeah, 2 hours ago.
Okay. And do you urinate regularly?
Yes.
Any difficulties, any pain or burning when you urinate?
No.
Okay. And how about when you move your bowels? Any constipation?
No.
And you move your bowels regularly?
Yes.
No pain when you move your bowels?
No pain.
Okay. So first thing you do is look. So abdomen is round. Skin tone is even throughout. No lesions. No visible hernias noted. And redness, no swelling, and no wounds. First place you auscultate to is the right lower quadrant, and then you listen in all four quadrants. So let's just say that the patient has normal vowel sounds were heard throughout all four quadrants. And then you palpate and you're checking for any tenderness. You're checking if for any distension. You're checking to see if there's any hardness. So patient has a soft abdomen, no tenderness noted or reported, and no palpable hernias or any no nodules. And no constipation and no urinary retention or difficulties reported by the patient. Now we're going to move down to the muscular neurological and the peripheral vascular. So first I'm going to look at his hands, and we already tested for sensation. We tested for strength, and capillary refill, as I said before, was less than 3 seconds bilaterally, and reflexes on the upper arms were good bilaterally, 2+ bilaterally. So we did the upper arms. We're going to test the range of motion of his neck. Can you bring your chin to your chest? Can you bring your head all the way back? Okay, bring it back to the middle. If you can turn your head to the left, back to the middle, and now to the right. Okay, back to the middle, and go around. So patient has full range of motion of his head and neck. And strength was 5+ earlier when I checked with the tape pressing against my hand. And then full range of motion flex, flex, flexion and rotation and induction of the neck. And no signs and symptoms of pain or no tenderness reported by the patient. So now we're going to do again the arm flexion. So you can bring your arms out to the side for me and bring them back to your body. Okay, you can bring them in front of you. And any tenderness or pain when you're doing that?
No.
Okay, you can bring them back down. So patient has full range of motion of his bilateral arms. He's able to adduct, abduct, extension, and flexion. So now we're going to move down to his knees. So first thing I would like for you to do is I would like you to stretch your legs, extend both your legs. So for the purpose of the video, I'm just doing it right now. And can you bring your legs back all the way back? Okay, can you lift one knee up at a time? Any pain or tenderness?
No.
Okay. And if you can close your eyes, I would like for you to tell me where, again, we're going to do the sharp and dull. Okay?
Do. Sharp. Sharp. Do. Sharp. 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 Do. Do. Do.
Okay, so he has full sensation in his okay. And I'm going to check this. I'm going to check your plantar flexion. Okay, so first I'm going to, okay, so can you lift your feet up for me? So, both feet, please. Okay, so don't let me push your feet down. Okay, and don't let me push them up. Okay, relax. And so he has bilateral 2+ plantar flexion and plantar flexion and flexion is 2+ bilaterally. Okay, so now I'm going to check popliteal pulse. So bilateral popliteal pulse is not palpable. This one is very hard to palpate. Normally, you would have the patient laying down. We can check different positions to try and feel it, but you have to continue to feel for the other pulses to make sure the circulation is going down. So while I'm here, I'm also going to check your reflex for your knee, your patella reflex. So you can bend both knees, relax your leg, sit all the way back, please. So normally, when you're checking the reflex of the patella, you would extend the leg. And so for the purpose of the video, we'll say that the patella reflex is a 2 plus. Patient has full range of motion of his knees, 5 plus 5 out of 5, and extension of the legs 5 out of 5. And now we're going to do the heel to shin test. So you please bring one shin, one heel to the shin, and all the way down. Do it again, please. Okay. So heel to shin test is a 2 plus bilaterally. And now we're going to detect the patella reflex. Now we're going to check the Achilles tendon reflex and the plantar reflex. The pulses. So I'm checking the posterior tibial. Posterior tibial pulses is a 2 plus bilaterally. Select please. Pedal pulses is a 2 plus bilaterally. I'm going to check for the popliteal reflex. Popliteal reflex is a 2 plus bilaterally. And also we're checking the plantar reflex. Normally it's an upside down J. And Babinski's reflex is negative. Check all the toes. Capillary refill. Capillary refills is a less than 3 seconds. Bilateral. I also have to mention that the temperature is warm. Bilaterally, there's no temperature is even throughout, and also on his upper extremities, the temperature is even throughout. There's no swelling, no redness, no lesions noted to the lower and upper extremities, and no nodules. So now I'm going to go up and check the upper extremity. I'm going to check the upper extremity reflexes for his arms. So normally you would need a reflex hammer. So for the purpose of the video, that's the brachial. And then we have this is the bicep. And then this is the tricep and the radial brachialis. Again, bicep, relax the arm, tricep, radialis, relax. The bicep reflex is 2 plus bilaterally, tricep reflex is 2 plus bilaterally, radial brachialis is 2 plus bilaterally. This concludes head to toe assessment. Do you feel comfortable in the position that you're in?
Yes.
Okay, here's your call light, here's your night table. I bring the remote control and all your belongings. Is there anything that you need before I leave the room?
No.
Okay. And I remove privacy, I remove my gloves and wash my hands and exit the room. Come back to the patient and I provide privacy again. And I wash my hands, I don on gloves, I explain to the patient, I'm sorry, Mr. Gonzalez, there was a part of the test that I forgot to complete. Do you mind if we complete it?
Yes.
Is it okay to complete it?
Yes.
Okay, I just need to check your gait, okay?
Okay.
So if you could stand up for me, please. If you can put your hands out to the side for me. Close your eyes. We're gonna wait for 20 seconds. So we're checking for number test was negative. There was no swaying noted in the 20 seconds. Can you stand back up for me, please? Okay. And now we're just checking the gait. Walking. If you can walk towards me and turn around and walk back, please. Okay, you can have a seat. So gait is steady. Again, wrong versus patient has good gait. No stumbling noted and no difficulty with walking and no limping. Okay, so thank you, Mr. Gonzalez, for being so accommodating to my assessment and for your participation. Again, I'm going to give you a call light, your belongings. Is there anything that you need me to get for you?
No.
Okay, are you comfortable in the position you're in?
Yes.
Okay, thank you again. So I remove privacy and I wash my hands and I exit the room.